The virus did get in through an asymptomatic carrier. That individual passed multiple medical screens and temperature checks. We do have a fairly small footprint for a facility, and so just as it's seen with many congregate living settings, it just spread very rapidly.
The CDC was working with Island Nursing Home to help with staffing and also to try to help them through this crisis they were experiencing with the pandemic. They reached out to us. We came up with a plan that would enable our students to be able to work for them as nursing assistants during their winter break.
So when I went in there with the willingness to learn and to apply what I've learned in nursing school at UNE and to apply it there.
When we got the opportunity to come out here and help out at the nursing home and be hands-on, especially with COVID going on and a lot of people not being able to work, I really took that opportunity to help out where I could and decided to come up.
It definitely has reaffirmed my decision to become a health practitioner. I think as a physician, you really need to understand the roles of CNAs and nurses and understand where patients are at. So the fact that they're here at the nursing home and being able to work with them hands-on is a really good experience that will follow me through my career.
The faces on those patients is what sticks with me most. The grief that was on their faces, the isolation that has affected those older adults in those environments. One resident in particular who actually cried. I could see tears in her eyes when I was leaving. That was kind of devastating because I knew when I came in there, the thing that was on my mind was to try to put a smile on their face, because I know how difficult it is to be in that room for 2 weeks and to not have any visitors. I always try to put a smile on their face, and I like to bring that energy with me. And she even discussed to me how when a friend and I came, we kind of brought that energy with us, and they were thankful for that, and they feel as though it won't be the same. And that stuck with me the most, and that's something that I will carry on with me with my future residents and future patients that I deal with, to always bring that energy and that positivity.